as I suggested in the beginning, maybe some of these episodes will be continuing medical education. So we want to make sure that we speak to clinicians as well. We are just getting to the point where there's a comfort with low carb keto, and we're still not there with carnivore, right? There's a comfort, not even close, right? And thank God, there will be research led by people like, Sean Baker, et cetera.
Mm-hmm.
Now, having said that, if you were to speak to a clinician and convince them that keto won't kill you, saturated fat does not cause heart disease, anything you would share with them to, make them feel more comfortable with the idea of advising their patients or them personally taking the journey where they are doing carb restriction to improve their health.
Yeah, it's such a good question. It's something that's a little bit intimidating, honestly, in the beginning, because you have to learn about, like when I first started it, I was just doing it because I've heard it was good. And, it made sense to me from the science that I read in the obesity code. But, when I started to dig into it, I'm like, this could be the answer to all of these little ailments I've been seeing. It was like real science, real research that you're doing on your own. It's like, wow, like I've been noticing people have all of these little things that probably should react to this type of a shift, like you said, either any branching out from the standard American diet. So
Right.
with precautions, but it's a very common concern with clinicians. When I do talk to other doctors, the cool thing about talking to other doctors when you're a doctor is that they're inclined to not believe you're crazy. So they're, when you start saying this stuff, they kind of have to listen. They're like, okay, you don't seem like you're that crazy, so I'm going to listen a little bit, but they hear the word keto and they do get a little, you can see them kind of tense up. But I think that, one doctor said to me specifically, she was like, I think it's good if you're not eating just hot dogs and cheese. And I'm like, that's the problem. We think that it's just processed food that's keto. No, like it's supposed to be equality food and, clean eating and things like that. And I think that's where the intentionality has gotten lost when you talk about keto. There's a lot of, and that's what drew me to it, was that, wow, this is really something I have to think about, that I can't just look at a book and pick a food. I have to really know what I'm buying and what I'm eating when I go to a restaurant and things like that. So something that I often say, just very simply, to people or doctors that are thinking about it, I say, well, what do you think about like chicken and broccoli? Oh, well, that's a healthy meal, and like that's considered a ketogenic like a meal. If you ate that all the time, you would probably be in ketosis.
Right.
And they're like, oh, so I think there's that shift of thinking. I think there are some doctors that still believe ketosis is the same as ketoacidosis, which you hear a lot of us talk about. And that takes some teaching and training. But I think really, something that was very important for me was not just the practicality of it, but just telling people to listen to their patients. I don't think I got to mention this to you, but, I left traditional medicine last year because it became a very big moral problem for me. I couldn't shift where I was. I couldn't, make things happen like you've done so well in your position. And so I was like, this is not working for me. I know I have these answers and I'm not able to use them the way I want to. And so that led me to Clubhouse and being able to really just sit and listen, because I wasn't under a time constraint. And being able to just hear people's stories talking about the ketogenic lifestyle and things similar to it. That was amazing for me. And I encourage a lot of doctors to do that, because we want to have an answer. We're so used to having an answer. We're always running a diagnosis in our heads. If we are interacting with a doctor, that's what we're doing. If we have that far off look, we're trying to think of those 5 things that this might be that you're telling us. But I encourage doctors, healthcare professionals to just listen and hear what they're telling you. So many people, and you can't fight those anecdotal, we try to discount anecdotal evidence, but just listening to hundreds, maybe even thousands of people over the course of 2021, just talk about all the improvements in their life, their lifestyle, things down to their relationships, their, the way that they interacted with their coworkers, like all of this stuff came out of them changing their lifestyle. And that, for me, was an even bigger turning point. Even though I knew it worked, when I heard that over and over and over again, it really changed things. So I encourage people to just, if you have a patient that says, hey, I'm doing keto, listen to them. Just hear what they're saying about it. Ask them what they're reading about, because a lot of the stuff they're looking at on it really is, helpful to us as well, because there's a lot of science behind it.
Yeah, I agree. I am lucky to be in a health system that doesn't necessarily endorse what I'm
Mm-hmm.
doing, but it allows me to do it.
Mm-hmm.
And I'll take it even a step further. We have something called Advocate Aurora Enterprises, which focuses on the seniors, the new moms,
Mm-hmm.
and wellness in general.
That's cool.
And under that umbrella, there's things that we can do. Like they have Food Smart, which is an app that allows us to, have something in your hands where you have a nutrition professional who's also a coach. We
Mm-hmm.
also are working on a weight management program. But the point of it is, people on the weight management program team are also doctors who understand this. So when you're in a room and you have 10 people, or virtually nowadays,
Mm-hmm.
and we're talking about ways to improve health metabolically, when you bring up keto and low carb, you have at least a few people on the table who are like, oh yeah, I do it in my practice all the time.
Mm-hmm.
So I think, for any clinician listening to this, we do need a community. So, but you'll be surprised. I have a future guest who I'll probably ask to join the podcast, one of our urologists. He called me about a patient, and he said, yeah, I checked out a few of your podcasts. I've been doing keto for 10 years. I had no clue,
Wow.
right? I had no clue. So I think there are people, and sometimes doctors will do keto and not recommend it because of
Mm-hmm.
the repercussions. Like, well, I don't know if it's okay to recommend, but guess what, docs? It's okay, because the American Heart Association,
Mm-hmm.
the American Diabetes Association, and the Society of Endocrinology, they're all endorsing, or at least saying it's one of the dietary patterns you can choose. So I think we have enough evidence, and it's okay. And I agree with you. It's not about eating hot dogs. Now, some people, Dr. Eric Westman said, if you got to eat a hot dog, or if you're a trucker and you got to eat a burger on your
Mm-hmm.
way and just do it bunless, you can still do that.
Mm-hmm.
But we want to eat real foods that are not processed. And if you have to eat that way periodically, even a vegan, it's okay to eat an Impossible Burger
Mm-hmm.
sometimes, but that shouldn't be your go-to.
Exactly.
See what I'm saying? It's still a
Mm-hmm.
processed food. So I
Mm-hmm.
totally agree. Um, and and so spreading this message is so important, because it helps our patients and friends and family achieve metabolic health.
Mm-hmm.
I know you mentioned the obesity code, but any other resources that you've used that may be helpful to my listeners, even to a clinician, what other resources would you recommend that people go to learn some of these concepts?
Yeah, absolutely. I mean, shameless plug. I often tell people about your podcast and your content because it's so simple and it's easy to understand, and people can get a lot from that. And it just shifts things. It's like, oh, okay, this doesn't
Yeah.
sound so, off the wall. But so I definitely, people that are listening, of course, are already listening. But going back and revisiting some of those. We talked about the book, and Dr. Fung. He's a big resource for me. As far as fasting and just things in general involving metabolic health. Dietdoctor.com, I really use a lot for me and patients and things like that. In the past, when I was in traditional medicine, that was a resource I used a lot. Because I felt like it gave them a simple way to eat, where they didn't have to think about it a lot of times. That's something that comes up a lot with single moms, and for me is still an issue sometimes. It's just the convenience of finding something quick to make. As much as I love to cook, I don't always have time to do it, so that really helps. The Society of Metabolic Health Practitioners, which I know you're a part of as well, has a lot of really great information. Early on in my journey, I discovered the Nutrition Network and did some of
Hmm.
the content there. So that's really good if you want to get into the science of it. It's really important to do that. But I really encourage, especially patients, people with bodies, to say,
Right.
we should learn about our bodies. Finding resources that tell you about how the human body works. And you can do it on a very basic level. You can get books that are made for kids. You know, we say this about the Bible sometimes, to go get a kid's Bible and read it because it
Yeah.
helps you to understand. Same thing with the body. You don't have to read the, pathophysiology textbook, but if you want to read that, it's very fascinating. You know, I'm biased, but but you can find all this stuff online. I was talking to some students and residents recently and realizing how much more technology they have in the palm of their hand. Just really like, I shouldn't have been surprised, but hadn't thought about it. Where you can just look up, this particular part of the heart or what it means and what it does. And so I think that that's important for people to do, because I really believe in empowerment through education. Your doctor can tell you some things, but like we've been talking about, it's hit or miss. There's some doctors that know this
Hmm.
lifestyle, know what to do, and there's doctors that just don't, that aren't focused on metabolic health. That we still think of metabolic syndrome as syndrome X. We don't know where it comes
Right.
from. And so you have to have that knowledge yourself. It will give you a different position with your doctor as well. A doctor who's willing to listen will be happy that you know these things. A doctor that's
Hmm.
not may not be so happy about it. So it may be a good turning point for you. But just understanding it will give you a really, really good frame of reference and empowerment over your own body and what happens to it.